Based upon looking at pressure, the pressure and the flow are going to be related. So, like I was saying earlier, if we look at the blood that's returning from all areas of the body into the atria, when it starts the return, initially pressure is low, but as the blood builds up, pressure goes up. This means my tricuspid valve needs to open. At this point, blood pressure in my ventricles is what? Low or high?
Low.
Low.
No, it's going to be.
So, blood is going to flow into the ventricles. This valve is going to close. Pressure is going to now be what? High. And then I have to go into the pulmonic valve. So now, when the pressure goes up, it opens this valve, pushes it out, and then the same thing happening over here on the left side. Just like what we saw in that little video. So in this movement, okay, hold on. That's just what I explained. I thought I had gotten rid of that slide. So like I was saying, as the blood returns to the atria, atria pressure is low, blood fills up, pressure goes up, atrioventricular valves open, ventricle pressure is low, blood flows into the ventricles, pressure goes up, and they move into the pulmonic and the aortic areas. All right, it's pretty much all I want you to know. Pressure's low when it fills, goes up, valves have to close, boom. Just like what we saw in a little video. This is the graphic of what's taking place.
What?
Do the valves have like pressure upstairs essentially, or they just burst open?
It's just a movement based on the filling of the chambers. Let me see if I can pull the video back up.
I thought it was based on the nodes, because that video makes it look like
This
there's an
is
electrical
the-
firing next to the valve.
That's your heartbeat.
Ah.
This is the movement of the blood.
Okay.
Oh.
Okay? Yeah. So let me see if this will play.
So
again.
this is movement of the blood.
Comes in through the body.
Oh, I gotta turn the.
Why does it say low at the?
Go back
To the left of your breastbone or sternum. The purpose of the heart is to pump blood through blood vessels, arteries, and veins to all parts of your body.
Watch how they
The
show the
inside of the heart is divided into 4 chambers.
opening and the
The
closing.
top 2 chambers are called the atria and are collection chambers for blood. The bottom 2 chambers are called the ventricles and receive the blood from the atria and pump it to the lungs and the body. The chambers are separated by valves, which control the direction of blood flow. There are 4 valves: tricuspid, pulmonic, mitral, and aortic. Circulation begins at the right side of the heart, where blood from the body comes to the right atrium.
See how they're showing flow,
This blood
stop,
passes
flow,
to the
stop,
right
flow,
ventricle,
stop,
where
and
it is
then flow,
pumped to the
stop, flow,
lungs to
stop, flow,
receive
stop. That's based on the pressure
Once it
building up and
receives
needing to be
oxygen,
released.
It flows to the left atrium and then to the left ventricle, where it is pumped to the aorta and the rest of the body. On the right side of the heart, the tricuspid valve separates the right atrium and the right ventricle, allowing blood to enter the ventricle but not flow backwards to the atrium. Blood flows through the pulmonic valve to go to the lungs. On the left side of the heart, the mitral valve separates the left atrium and the left ventricle. Blood flows from the left ventricle to the aorta through the aortic valve and to the rest of the body. Arteries carry blood with oxygen and other nutrients throughout the body. Veins take blood back to the heart, which pumps it to the lungs to be oxygenated. The heart arteries, coronary arteries, provide oxygen and nutrients to the heart muscle. The right coronary artery supplies blood to the bottom and the back of the heart. The left coronary artery splits into two vessels. One branch supplies blood to the front of the heart. The other branch delivers blood to the left side of the heart. An electric system transmits signals throughout the heart to control its pumping. The electrical signal starts in the sinoatrial, or SA node, which is located in the upper portion of the right atrium and is known as the natural pacemaker of the heart. The electrical signal passes down to the lower chambers of the heart via the atrioventricular, or AV node, which controls the signal so the atria contract before the ventricles. In the ventricles, pathways carry the signal throughout the muscle so that they contract at the same time to pump blood to the lungs and through the body.
Which is kind of cool. So does that make sense, seeing it again? With the movement, close, open, close, open, close, open, okay? And you're probably thinking the sinoatrial node because of what's happening with the actual contraction of the heart. What's happening is, as it does that contraction, that's helping to push the blood from the ventricles into either the pulmonary or the aorta. Okay? So, pretty cool video. All right, and Lucy, did you have a question?
No, I was just wondering why it says at the top in that picture you drew, it says low, but the low I thought was.
Well, I was just saying when blood starts to flow in, pressure is low. But as it fills, pressure goes up. This valve has to open, and we flow into where it's low pressure. And as this fills, it has to open to go into the pulmonary.
Okay.
And the same thing's happening on the left, just going into the aorta.
Gotcha.
All right. So some of the disorders that can happen with our valves, one that's pretty common, mitral valve prolapse. Like I was saying before, this is where on the left side, the cusps have something that go wrong. It could be either one or both of the cusps, and they'll create a bulging when the ventricles contract. Now, usually chest pain, shortness of breath are some of the signs that this might be happening. They'll check for this. It can be hereditary. They'll usually talk about maybe like as it progresses, doing a valve replacement. Okay, that is an option that you have now. When we talk about the valves hardening, this would be valvular stenosis. Basically, the valves are not as flappy as they should be. They are a little more stiff and hardened, and that can make the heart work harder. Now remember, the heart is muscle tissue, and this would make the heart enlarge, which is not good. All right? It could be due to something that is a result of rheumatic fever, which used to be more common than it is now. I don't know if it's even, I don't hear of it at all. It can produce a heart murmur. Now, this would be different from other heart murmurs probably because it is going to be something that's always present. And that would be letting the doctor know, hey, let's check this out. See if we can find out what the reason is for that heart murmur. Because one of the things you do in your profession that you're choosing. And then as we go into clinical areas, they're going to listen to our hearts. Anybody in here ever used a stethoscope? Other than to just hello, 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 okay? Where you're actually placing it in areas to listen, okay? As you go through your training, you'll be trained on what to listen for, all right? And based on, you know, the deep breath and that sort of thing. But the listening itself is auscultation. The sounds, for the most part, two, okay? The first heart sound, the second heart sound, the two together make it sound like dup-dup, dup-dup, boo-boo, boo-boo, okay? Ever kind of just been, you know, had your head laying on someone's chest and you hear their heart beating, okay? Have you ever just paid attention to it? All right, I mean, you know, you probably will now that I've mentioned it, okay? Here's what's happening. It is from turbulence in the bloodstream. Turbulence. As the blood moves through the heart, and as we hear those valves opening and close, well, we don't really hear that. As those valves open and close, open and close, they are creating turbulence in the flow. Stopping it, starting it, stopping it, starting it. And that makes it have sound. And this is what we're hearing. So, the first sound is louder and longer. The second sound, a little bit softer. S3, this third sound, it's very common in children, adolescents, that sort of thing. It's very seldom heard in people over 30 unless it's usually, okay, well, you've got a little heart murmur. Okay, well, why? I mean, you know, try to tell me, oh, you got a heart murmur. Okay, and, oh, it's nothing to be worried about. Wait a minute, there should be two sounds. Now you're telling me there's a third one, I shouldn't be worried? It's probably due to the fact of what I teach, okay?
So are you born with a heart murmur, or is it something that you can get like as you get older? Some people are born with them, right? But then is it something that you can get after as you get
Yes.
older as well?
As you get older, and it could be the result of maybe the valves having something go wrong. Sure, there are other reasons for a heart murmur. Most of the time, they just they'll tell you it's nothing to be concerned about. Yeah. Not sure how I feel about that.
Well, you can grow out of them too.
Well, like I
I
said,
had one, like, I had pulmonary stenosis when I started doing cross country, and they said, like, you can sort of, like, train your heart to get rid of the murmur.
well, younger, like infants, adolescents, children, they will have them more commonly, but they may disappear.
And runners prevent stuff like that?
Okay.
Exercising and running.
The exercise cardio is referring to the fact that you are strengthening the myocardium of your heart. What that means, you're training the cells to be more effective. That's not meaning that it's making the heart stronger or anything like that. You're training it to be more effective. That's it.
Wait, so the S3 is that considered is it